Hello, I'm Diane. I'm a consultant in obstetrics. Now, one of the common questions that I get asked is whether you can continue exercising when pregnant. The good news is yes, you can. Exercising during pregnancy is very beneficial, but it's important to take some precautions. So safe exercises during pregnancy include walking, swimming, stationary cycling, and low-impact aerobics. These exercises help to stay fit without putting too much strain on your body. You should avoid contact sports with a high risk of falling, and exercises that involve lying on your back after 20 weeks of pregnancy. Remember, always listen to your body and stop if you feel any discomfort. And as a general rule, I always say that pregnancy is not the best time to be starting an unfamiliar exercise routine. If you're thinking of starting an exercise routine that is not familiar to you, then it might be best to consult a healthcare provider and ensure that this is safe for you and your baby. Now, another common question that I commonly get asked is whether it's safe to fly during pregnancy. Now, generally, traveling by air is safe up to 36 weeks of pregnancy. However, there are some things to keep in mind. First, it's always a good idea to discuss your travel plans with your healthcare provider, especially if you have any pregnancy complications or concerns. Where you're traveling to is really important to ensure that you have access to maternity services if needed. After 28 weeks, most air travel providers will require what we call a fit to fly certificate, and so speak to your midwife, your obstetrician, or your GP as to whether they're happy to provide this for you. Second, with long haul travel or road trips, staying active during these trips is so important to reduce the risk of blood clots in your legs or in your lungs. Wearing compression stockings, keeping well hydrated, and avoiding caffeine and alcohol is also advised to maintain good circulation and further minimize this risk. Finally, take your medical records with you. Ensure that you can access them digitally in the case of an emergency. Now, if you've accidentally had a drink of alcohol before you knew you were pregnant, don't panic. Having a small amount of alcohol before you know you're pregnant is unlikely to cause any harm. However, once you know you're pregnant, it's best to try and avoid alcohol as much as you can to prevent any potential risks to you and your baby. Now, generally in pregnancy, you're trying to maintain a healthy lifestyle. Stopping smoking, having a well-rounded diet, and taking regular exercise are all really important aspects to maintain the health of your pregnancy. If you have any concerns or questions about alcohol consumption during pregnancy, then please discuss them with your healthcare provider for further information, personalized advice, and also support. So let's talk about folic acid and pregnancy supplements. Now, folic acid is essential for preventing neural tube defects in the developing baby. Not having enough folic acid before or during pregnancy is one of the most important factors that can increase the chances of having a child with a condition known as spina bifida. So folic acid, also known as vitamin B9, occurs naturally in some foods such as broccoli, peas, and brown rice, but it's recommended to take prenatal vitamins that contain folic acid for at least 3 months before conception and then throughout the pregnancy to the end of the first trimester. These supplements will help ensure that you and your baby get the necessary nutrients for the healthy development of the pregnancy. If you have an underlying healthcare condition relating to some of the medications that you might take, or you've had a previous pregnancy that's been affected by a neural tube defect, then your healthcare provider might recommend that you take a slightly higher dose of the folic acid than what is routinely recommended for pregnancy.